We know the world is scrambling to find a vaccine for the Wuhan Coronavirus. All we hear at the moment is that we do not have enough test kits, we do not have enough ventilators. A preventive shot, we know, can help save millions of lives that are at risk right now. But how vital are tests and ventilators? If someone is tested at an early stage, and if someone got ventilator support, will this patient survive the virus? Are tests and ventilators the difference between life and death? We try to find the answer to these questions, and we'll try to answer them in the next couple of minutes. We've spoken to various medical experts and doctors. First, let's begin with the coronavirus tests. COVID-19 tests involve taking a swab from the patient's nose and throat. The sample is then checked for the genetic footprint of the virus. Can an early test help save someone's life? The answer is that it totally depends on the condition of the patient. 85% of the coronavirus patients the world over recover without any serious medical assistance. It is the remaining 15% for whom the coronavirus battle becomes difficult. If a patient already has other health problems, say hypertension, chronic respiratory disease, diabetes or cancer, then even an early test may not be able to increase his or her survival chances. So a test is not the difference between life and death. Where a test really helps is decreasing the human-to-human transmission. You may or may not need a test or medical intervention, but at least you'll not be the carrier. And this decreases the number of positive cases. That is why tests are important. And that is, you can decrease the number of cases by quarantining and isolating coronavirus patients. Currently, most tests take 24 to 48 hours to give results. The Indian Council of Medical Research, or the ICMR, has tested a little over 25,000 samples so far. Smart tests are what we need right now. Tests that can provide quick results. Next, the role of ventilators. Will more ventilators translate into a drop in the coronavirus mortality rate? Again, we posed this question to experts and their answer was no. More ventilators do not necessarily help. They'll be good, yes, but they will not stop deaths. Let's first understand the role of ventilators. The machine has two important functions. It blows oxygen into human lungs. It expels carbon dioxide. Basically, a ventilator does what our lungs do. They're required in treating a coronavirus patient because this virus impairs our respiratory system. Patients have difficulty breathing. Most of the patients are given artificial oxygen supply, but in some cases, patients develop pneumonia in lungs. Some also suffer a severe acute respiratory failure, and in these cases, ventilators are needed. These machines act as a life support system. They provide oxygen, they expel carbon dioxide, but ventilators cannot guarantee life. A patient's chances of survival depend on the condition of his or her body. For example, in some cases, coronavirus triggered multiple organ dysfunction. A ventilator cannot do much here. How many ventilators does India have? No official figures. The estimates range from 25,000 to 40,000. This is for a population of 1.3 billion. The need of the hour is not just ventilators and testing kits, but also manpower, experienced doctors, nurses, technical staff. As I said, it's a long fight ahead.